Hi, I thought about risk into succession after monovalent rotavirus vaccination. I studied nursing at school, San Vincent of Paul. My name is Joscelyne and my teacher is Master John Moscos. Definition. What is intussusception? Intussusception occurs when a portion of the intestine follows a telescope, with the one segment slipping inside another. This causes an obstruction preventing the passage through the gut of food by digest. Application in medicine. With regard to medical, pharmaceutical part, it's hard to elaborate a type of vaccine that is not associated with intussusception. This vaccine, called Rotatec, is also given formal oral.
Rotavirus is the most common serious diarrhea illness in infants and small children, responsible for over 500,000 deaths worldwide. Now, it is not a question about whether your child's going to get rotavirus. They are, and in fact, they're probably going to get it multiple times. It's most severe the very first time when you're over 3 months of age. Now, rotavirus is spread through the fecal-oral route. Want to make sure you wash your hands real good. It's also spread through contaminated food and contaminated water. Has a very short incubation period. From the time you're exposed until you're sick is about 48 hours. Symptoms include terrible diarrhea, vomiting, low-grade fever, and some awful diaper rashes just from the sheer amount of loose stools. Complications include severe dehydration, electrolyte imbalances, and death, usually due to overwhelming organ failure from the dehydration. Prior to the vaccine, even in the United States, rotavirus was a terrible disease, usually responsible for over 400,000 office visits, 200,000 emergency room visits, and between 50 to 75,000 admissions to the hospital, usually 20 to 60 deaths per year, even in the United States with modern medicine. Now, in 2006, the viruses were licensed as a vaccine. There's two different types, both of them given orally, and either in a 2-dose or a 3-dose schedule that's given at 2 months, 4 months, and 6 months. The vaccine's not given to anyone after the age of 8 months simply because older children are able to tolerate the dehydration better and be encouraged to drink so that they don't have as much problems. Now, it is a live vaccine, so there are some reasons not to get this vaccine. We don't give it to anybody who has a severe immune problem or a moderate to severe illness. We shouldn't give it if somebody's had an allergic reaction to one of the components of the vaccine or has a history of a condition called intussusception. Intussusception is where the intestine telescopes inside of itself and can require surgical intervention. Common side effects include vomiting, diarrhea, low-grade fever, and some fussiness. This is a vaccine that's pretty well tolerated by both the parents and the children because it doesn't come with a needle. The other thing is, to the little kids, it tastes like sugar. So it's not a bad vaccine to receive at all.
Pro. Full vaccinate provides protection. First, 7% against rotavirus diarrhea of any severity in 1 or 2 years after vaccination. Second, 85 and 100% against severe gastroenteritis require hospitalization. Third, 42 and 58% of hospital admission for diarrhea of any etiology. This suggests that many of rotavirus cause diarrhea in which there is a specific etiologic diagnostic established.
Regular trips to the doctor are a normal part of a child's first year. Baby Jose, baby Stanislav, and their moms are here to see their pediatricians at Harvard Vanguard in Boston.
Hi, Stan. How are you?
During this visit, both babies will receive routine immunizations, including the rotavirus vaccine.
Immunization is very important because it protects them against vomiting diarrhea disease that is very common for babies.
Good job, Baba.
Several years ago, a rotavirus vaccine was withdrawn from the market after being associated with an increased risk of intussusception. In this uncommon disorder, a portion of the small or large intestine slides forward into itself, much like a telescope, causing severe abdominal pain and vomiting.
Because the rotavirus vaccine is given to almost every child in the United States, it's crucial to monitor the vaccine's safety.
Dr. Irene Shui from Harvard School of Public Health and co-authors studied the Rototech rotavirus vaccine, which became available 6 years ago. Almost 800,000 infants aged 4 to 34 weeks received this vaccine from May 2006 to February 2010, including more than 300,000 first doses.
Our study did not find an increased risk of intussusception following the rotavirus vaccine.
The study appears in this week's JAMA, Journal of the American Medical Association.
This result was the same whether we looked at the longer 1 to 30-day risk window following all doses of vaccine, and in particular, when we looked at the first week following the first dose, we also did not see an increased risk.
We're going to do rotavirus.
That's a little drink.
That's a little drink.
Researchers say introduction of the rotavirus vaccine has a tremendous public health impact for children like Jose and Stan.
The benefits from rotavirus vaccine in terms of reducing the number of hospitalizations and deaths from rotavirus disease far outweigh the potential risk of intussusception that might exist.
Thank you, Angel. Aren't you doing great?
Catherine Dolph, The JAMA Report.
There we go.
Con. Anaphylactic reaction to a previous dose of rotavirus vaccine or any component of the vaccine. History of intussusception or intestinal malformation correlated with high risk of intussusception.
From birth, young children are natural explorers. But as parents, there are some things we hope they never discover, such as the physical and emotional pain of a childhood disease like rotavirus. But what is rotavirus? Well, it's no one's best friend. It's a clever character, lingering on mucky hands and jumping effortlessly between children's bodies, as well as the toys they're playing with. As a new parent, you may be given advice on how to avoid inviting rotavirus into your home. Hand washing can help prevent transmission, whilst breastfeeding your child can provide some natural protection. But even with these precautions, almost every child is infected by age 5. Take your typical family. Rotavirus usually makes an appearance in the cold season, entering the body through the mouth. Once it infects the digestive system, the results are worrying and often frightening. Vomiting and diarrhea, as well as fever and even dehydration. There are no antiviral medications to treat the disease, so the best thing you can do is to try and rehydrate your child as much as possible. This, however, can be especially difficult to administer to small children, potentially leading to more serious complications. Since nobody wants to watch their child suffer with some distressing physical symptoms, trips to the doctor or an outpatient clinic are common. The most serious cases will involve multiple appointments and require a hospital stay of 3 days on average, which means that not only do you have a sick child, but you have to deal with huge interruptions to everyday life. In addition to the worry and anxiety caused by seeing your child suffer, you might also have the added stress of juggling work commitments, as well as worrying about the economic impact of medical costs and missed days of work. Is it any wonder then that many parents are left feeling physically and mentally exhausted by rotavirus? So how can our family be better protected? The most effective method is to avoid infection in the first place, making vaccination your best defense. How does rotavirus vaccine work? Vaccines boost the body's natural defense system, allowing it to produce antibodies that can fight bacteria and viruses. A child who has been vaccinated early against rotavirus is better able to fight it, if they happen to come into contact with it. The World Health Organization recommends that the rotavirus vaccine is given to all babies, because those countries which include it in their national immunization program have significantly lower levels of the disease. The earlier you take steps to protect your child, the better chance they have of avoiding a more severe attack, which, as we have seen, has to be good news for all the family. Talk to your doctor about protecting your child against rotavirus.
Issue aptly in Ecuador. Globally, there are different types of vaccine against the virus, among which are rotavirus ESK laboratory used in Mexico, Rotatec, Merck, ship monovalent vaccine, Curate used in China, the National Immunization Program Coordinator MSP, argues that Ecuador has not yet entered this medicine to the national immunization schedule, as has happened in other countries.
It's children who live in poor areas like this one in New Delhi who are most at risk of infections, many of them preventable. Reenu's 5-year-old daughter died a few months ago from severe diarrhea. She says it's impossible for people like her to protect their families from threats like this.
Of course I'm angry, because if the water was clean, if the outside was clean, why would my daughter die? Why would my children fall ill? We don't have money to treat her in a fancy hospital. For poor people like us, this is what happens.
Unsanitary conditions lead to more than 300,000 child deaths from diarrhea in India every year. 1/3 of those are caused by this, the rotavirus, which causes severe diarrhea in infants and young children. Most of India's poor don't have access to available vaccines. Now this lab in Telangana state has developed the first vaccine for the rotavirus made outside Europe or the US.
At about $18, vaccines available on the market are too expensive for most families whose children are likely to be infected by the rotavirus. The new vaccine developed at this lab will cost about $3, making it more available for those likely to be infected here in India and across the developing world.
In clinical trials, the new vaccine is shown to be about 58% effective, similar to other rotavirus vaccines.
People now recommending you don't want.
But its makers say it's only part of the overall solution.
It's a country of India, 1.2 billion. It's just impossible to clean up everything overnight. But this is part of the sanitation program. If you combine with this and combine with the sanitation, you will get instead of 58%, you may get even 100% efficacy.
Those who work with the poor agree, saying simple steps can make a big difference.
Like boiling water, like hand washing. Breastfeeding is also really important because mothers use dirty water with our milk powder. So we can really make a big dent in reducing these number of children that die through these simple interventions.
Health workers are trying to deliver that message on the ground, hoping that along with the potential of a cheap vaccine, children in these areas won't become another statistic. Fez Jamil, Al Jazeera, New Delhi.
Conclusion. In conclusion, it is necessary to apply the rotavirus vaccine to prevent intestinal discomfort in children. It is true that intussusception occurs in the first dose, but with most informed parents of the zinc of this disease to prevent serious complications.
This is one Natural Mama's look at the rotavirus vaccine. The rotavirus vaccine protects against rotavirus. It is a 3-dose vaccine given at 2, 4, and 6 months, and it is the only vaccine that is administered orally. Rotavirus is an intestinal virus that is transmitted through saliva and feces. So it's actually quite common at daycare centers where there's plenty of diaper changes and shared toys. Symptoms are like a really bad stomach flu. Rotavirus is usually not serious. In fact, many kids do fine at home as long as they're well hydrated. The babies said you have to go to the hospital or put on an IV. There really is no course of treatment for rotavirus. Once you get it, it just has to run its course. Rotavirus is usually not serious. In fact, many kids do fine at home as long as they're well hydrated. The baby said you have to go to the hospital or put on an IV. There really is no course of treatment for rotavirus. Once you get it, it just has to run its course. Rotavirus is very common. In fact, we see 2 million cases a year, and of those, the majority are infants and young children. Now, 20 to 70 of those kids will actually die, and that is due to severe dehydration. So we have to be sure we're employing common sense here. If our kid is having a lot of diarrhea or vomiting, let's be sure to keep those fluids in them and keep them hydrated. For some people, yes. This is a whole and live vaccine, which makes it very effective, but it also has a lot of funky ingredients, like monkey kidney cells and fetal cow blood. Rotavirus is essentially a bad case of the stomach flu, and the vaccine itself does cause side effects in 5 to 10% of the kids. Now, most of these are minor, but in some cases it can cause seizures. Given all of this, we decided against this vaccine. Keep in mind, though, our son is breastfed and not in daycare. If the circumstances were different, particularly under that first year, we may have considered otherwise. So there you have it, one Natural Mama's view on the rotavirus vaccine.
Thank you for your attention.